I'm Peg Bolgioni, Communications Specialist with Rutland Regional Medical Center, and I'd like to welcome you to Window on Wellness. I am pleased and honored to have Tom Huebner, President and CEO of Rutland Regional, as my special guest. Tom will be retiring from RRMC on March 31st, and during the program we will be reflecting on his time at the hospital and what the future will hold for him. I will be back with Tom Huebner after this message from Rutland Regional Medical Center.
I'm Tom Huebner, President of the Rutland Regional Medical Center. The Rutland Regional Medical Center is the largest community hospital in Vermont. We started back in 1896. We had 16 beds, 8 physicians, 1 nurse. This past year, we took care of nearly 250,000 patients, and we have 1,600 staff, 258 doctors. We are here to serve our community in every new way that is possible with this promise to you. We listen, we respect, we care, always.
Welcome back to our show. I am very pleased and honored to have Tom Huebner, the CEO and President of Rutland Regional, as my guest on today's program. Tom, welcome to the program.
Thanks for having me.
Yeah, well, I think we'll just get right started because we have a lot to talk about.
Great.
So I guess to start, I know that you're going to be retiring.
That is true.
Yeah.
End of March.
That's right. And so I think I want to go back a little bit and sort of ask you some questions, about what prompted you to, pursue a career in healthcare.
So it's kind of a funny story.
Okay.
I was in college,
Uh-huh.
and I was going to go to law school. I was a political science major up at Colby College up in Maine, and amongst all the political science majors, there are probably 60 people, applying to law school. And I went, boy, maybe the world doesn't need another lawyer. And I had a friend of a friend of a friend who was the assistant administrator of the hospital just down the hill from the school. And I arranged to follow him around one day for about 4 hours. So I walked down to the hospital, met him, followed him around for 4 hours. I said, you know what, I could do that. And I applied to graduate school in healthcare management, an MBA with healthcare management at Boston University.
Okay.
And that was my deep research into healthcare administration. And I went through the program. In 2 years. I started working half-time while going to school full-time. Worked at the Beth Israel Hospital in Boston, and then the Mass Department of Public Health. And here I am 43 years later.
Okay.
So.
Well, I'm just curious because, that's, quite a gap. After you finished grad school and you worked in Boston, how did you make your way to Rutland?
So I was in the Boston area for 15 years. 15 years. I had several different jobs in healthcare down there. Worked at the Beth Israel, as I mentioned. Worked for the Mass Department of Public Health. Worked for the Massachusetts Hospital Association, and then a community hospital for 8 years. In Christmas of 1989, my boss at that community hospital was fired, and they brought in a new CEO, and I met him, I remember the Friday before Christmas 1989. I went, oh, this is not going to work. And I had a friend who was then the CEO of Southwest Vermont Medical Center.
Oh, okay.
And he was literally the first call I made. And he knew the guy who was coming into my old hospital. He said, oh my God, I know him. You're right. You don't want to work for him. By the way, I know this new CEO up in Rutland, Vermont. I think you get along really, really well. Send me your resume. That was my first phone call. Oh my God. And I sent him the resume, and 3 months later, I was working at Rutland Regional.
Oh my God. Now, before you became CEO, what was your position?
So I was a vice president at the hospital from 1990 to 97. I always say I was vice president of stuff. I had a lot of different eclectic things. They hired me initially to build the Meadows and Gables, and then do new business development, strategic planning. Then I picked up a lot of the operations of the hospital, kind of was roughly COO, was a little more bifurcated than that, but nonetheless. And then when my predecessor, Jim Baus, passed away in 1997, the board offered me the job. There was no search. My interview was 1 hour long with 4 people, and they said, "Here, sure, you can have the job." Now I'd already been interim for a few months, so they'd already known me for 7 or 8 years, so I wasn't a new entity, obviously.
No, exactly. Oh, geez, that's quite a trajectory. It
Yeah.
really is.
It's funny, when I moved to Rutland, I said, you know, we'll be here for 3 or 4 years. And my wife initially was not crazy about the idea of moving from the Boston area up here. And then it became home, and then the work was so satisfying, and it ended up a place I stayed for all these years.
Wow, lucky us.
Yeah, lucky me.
So what was the biggest change that Rutland Regional went through while you were CEO?
Yeah. Easily the cultural changes both on the medical staff and the employee staff as a whole. The medical community, when I came in 1990, I've referred to before as the wild, wild west. Everybody was in private practice. Autonomy was the most cherished of all values. The hospital was sort of, by the docs, is seen as kind of not their friend, or at least sometimes that was true. And now it's collaborative, you know, collaboration's the key word instead of autonomy, people working together, high levels of physician engagement, much more of a multi-specialty group practice feel. And the employees too, the staff piece has just gone really, really, really well over the last few years. You know, we've focused a lot on staff engagement, as you know. And last year, the advisory board who measures that for us determined we were at the 85th percentile of healthcare organizations, and today we got notice that we are being recognized as one of the top 20 engaged workforces in healthcare in America. I'm really, really proud of that. Those are huge changes and really to the benefit of the community and to our patients.
Well, but I know over that time, I mean, you and the staff worked really hard to establish that culture.
Yeah, we did.
And I know there was a lot of different things that you know, implemented to make it a success. I didn't know if you wanted to talk a little bit about that, or?
Yeah, on the physician side, really 2 things. One is, now that we employ physicians, they're really part of the organization. It's just a different relationship. But probably more important than that is we've really embedded physicians into the leadership of the organization. You know, I always used to say that we pretended to pay physicians to help lead, and they pretended to lead. And now that's not true at all any longer. They're very active leaders, and that's made a huge cultural difference. On the staff side, we've really worked on engagement, certainly with the help of our Studer partners who've helped us with customer service. But my favorite thing about the engagement with staff has been when we first rewrote the goal and said we wanted people to commit their hearts and minds to the care of their patients and each other, and we needed to create an environment where that could happen. We didn't really know how to do that. So the best thing we did was we asked staff, and one of the VPs at the hospital, Jeff McKee, came up with this question. The question we asked a series of focus groups was, think of a moment in your life when you were all in. What were the things that allowed that to be? It could be at Rutland Regional, another employer, military, sports team, school, doesn't matter where. And they told us 8 things. The most important one on the list was I had a leader who supported me. I had a boss who had my back. And I do general orientation every 2 weeks. And every new employee I say, so did you ever work for a boss who didn't have your back? And if they've worked in the world for a while, every one of them raises their hands, because most of us have had that experience at one point or another. And I said, so how long? And they all say in their own words, as short a time as possible. Because people leave bosses, they don't leave jobs, is my experience. So if you feel like you have a leader who has your back, who supports you, who coaches you, who develops you, who is trying to make you better, that's what it really is the most important part. There are other things like teamwork and recognition and learning, and you know, that are really important. So we're fortunate. We have great leaders at Rutland Regional. Not one of them is perfect. God knows, me included. But if you have that sense that you are there to make the people around you better, help them be successful, you can do a million things.
That's great. So what are you going to miss the most about this job?
Well, kind of duh, right? It's the people and the sense of making a difference in the world. You know, when we did things like create the Meadows and Gables, which is, you know, assisted living and senior housing.
Right.
When we opened the Westridge Center for Opiate Addiction, when we successfully were able to stabilize the medical community by offering employment, when we create new programs, those services is really the thing I've enjoyed most, and the people who have been around that to make them successful. Because you can have a good concept of a program, but you have to have the right people to lead them and develop them and nurture them and all of that. I mean, there's not a day that any of us who work at the hospital should go by and not understand that what we do has an enormous impact on people's lives. And you know, how many people get to say that about their job? Not everybody, and
No.
it is such a gift to me, and I think to all of us who work there.
Well, I think during your time, I mean, I think the hospital's become not just the largest employer in the region, but also kind of a centerpiece for so many other things. You know, I mean, the giving back, you know, the community involvement, the community engagement, you know, with just being involved in a number of different activities. I think all that's just been part of its success.
Very much around economic development as well. You know, the hospital and many hospitals across the country were not unique in this. You know, they sort of stayed behind their brick walls and did their thing and did it well. Right. And now we see ourselves as sort of like, how do we support and be a central organization in the community at large? We are the largest employer. By the way, I wish we weren't. I wish there was more economic development and that we were not the largest employer. But if we don't step forward and provide leadership and sometimes funds for those things, who's going to do it? Right. And I talked to a friend of mine the other day, and he had the same thought I did, which is when we both began, it's like, that's not really our job. And now we go, oh, yes, it is.
Yes,
yes. It is important that we provide leadership on a broad basis and support in the community.
Right, and I know, and that's, you've led by example. You really have. So I guess thinking about this, what do you feel is the biggest challenge that Rutland Regional is going to face in the future?
Sure.
And how are they prepared to meet that challenge?
Yeah, I probably mentioned two. There's always going to be an economic challenge, meaning there's always this desire to cut reimbursement from Medicare or Medicaid or from commercial carriers, Blue Cross and the like. And fighting for the resources to do our job well, it's a challenge we've always had and will always continue to have. Healthcare is incredibly expensive. We do need to find a way to stop that growth. You know, healthcare is 20% of the economy of the United States now. That's kind of crazy. So slowing that growth, I'm hoping that a change in reimbursement systems will help with that. The other thing that is very Rutland specific that I worry about is the demographics of our community. We know Rutland County is shrinking at about 0.5% a year, and we know it's an older community. That's got to turn around. We need to have an economically vital community. We need to have more people. And people always talk about, you know, making sure kids stay in here when they graduate from high school and college. Totally agree. But that won't be enough, I don't believe. The Vermont Chamber of Commerce did this recent study that says Vermont needs to bring in 10,000 new people a year forever to allow the economy to stabilize and be balanced and have enough workers. I entirely believe that. That's a very difficult thing to turn and improve. So one of the things I would like to spend some time on after retirement still is working on economic development in Rutland to help see what we can do to attract people and attract jobs to go with those people. Our biggest problem at the hospital right now is probably also attracting enough talent. You know, as I've said before, at any given moment, we probably have 120 jobs open. It's a really difficult question right now. Yeah. So I think that's the ones I worry about, and they're long, deeply embedded kinds of issues that really are going to take a lot of work.
Yeah. Well, I'm glad you're sticking around to help out.
Yeah.
That's a good thing.
It's home.
So what has been the hardest part of your job over the years?
Ooh. Hardest thing I ever did was not at Rutland Regional Medical Center.
That's all right.
It was at my community hospital down in Massachusetts. And it made me better at my job, I think. They went through a very difficult financial time. The Commonwealth was literally trying to drive some hospitals out of business, and they were effective. I worked for a little 2-hospital system, and one day we got to a financial point where we had to close one of the hospitals, and I got to lay off 600 people. That is not something you ever want to do. Yeah. It's made me really aware of finances at a very deep level and how important they are to the strength of our organization, that if we have the resources, we can do anything. Yeah. So when you have to make difficult decisions that affect people's lives, who enjoys doing that? Nobody enjoys it. No. You know, it's the other side of building something and providing a cool service that's really important. When you have to make those kinds of tough choices, they're never fun.
No, I know. So what stands out as your biggest accomplishment in your 28 years at Rutland Regional?
Well, probably the cultural stuff we already talked about. There's some individual programs like the Gables and Meadows, like Westridge, like the physician practices, like entirely rebuilding the emergency department twice
I know.
in the time I've been there. But really the more important one is those cultural changes with staff and with the docs and having people work together effectively and frankly take great pride in their work. Yeah. And they should, of course. The staff are spectacularly wonderful.
And you're so willing. What I find so inspiring about you is you're always sharing the credit. You're always, giving it back to the staff and to the docs, because that's what you're about. Yeah.
I don't know. We might. My kids are, I think, going to show up for a retirement party. You might get an alternative point of view from them along the way.
Well,
we'll see.
maybe, but they know you differently. So I guess looking back at your career, knowing what you know now, is there anything you do differently?
Oh God, yes. I'm better.
Where do we begin? Right?
Yeah, I'm better at my job now than I was when I started. There's no doubt. I mean, experience does matter.
Yeah.
One of the things I did when I first became CEO is I didn't really know how to talk to staff because I had this kind of very business background and I was doing planning and I was not a clinician by training. And I started leading, I'd talk about, market share and bottom lines. And I'd see staff and they'd go like, yawn, it's like, what is he talking about? It's, Greek.
Right.
Because most of our staff live in the world of taking care of patients and clinical outcomes, and as they should, of course, that's what they do, and it's what we're all about. Me learning to bring those concepts together and using the patient piece of that to still talk about some of the business things which you do need to talk about. Boy, I could have started that a lot earlier and sooner than I did. It took me a while to figure that out. Individual program decisions, harder. Sometimes for certain decisions, certainly some personnel decisions, probably my biggest regrets were I didn't do some hard things sooner, honestly, because they're hard by nature, and you kind of want to make sure you're right. And almost all of those, I've after the fact said, "What the heck took me so long? I would have been better off if I'd done it sooner." Those are regrets for sure. As I said earlier, it's like everybody makes mistakes. You can't get this perfect. It's about learning from them and getting better and trying not to replicate the same ones again and again.
That's right. So what advice do you give for the new CEO coming on board?
Listen and build relationships. This is a people world, a people business for sure. There are great staff, great leaders at Rutland Regional. take great advantage of them because they'll be able to make you better, teach you things, learn to love your patients and the community because it makes everything possible. We'll find the right people. The board's doing a great job in the search process, and they're very aware that the right cultural fit, both from a community point of view as well as a staff point of view, is central to the success of the next person. So, and hopefully they'll bring great new ideas on top of, build on the great foundation we've got. But I'm counting on that person to think of things that I've never thought of. That will be as it should be. You always want to take advantage of that.
So the last question is, what are the plans after retirement?
Yeah, good question.
Retirement.
Yeah. I don't know. It's kind of daunting, to be honest with you. I've said this to many people. I've worked since I was 9, starting out mowing lawns like kids do and shoveling snow and that kind of thing. And then I worked in a store and a delicatessen, washed dishes in college, did all that stuff. And so I've always sort of worked. Not to have to go to work every day, it's like, what would, I can't even imagine what that would be like. And I'm a really bad bored person. I mean, I don't do well being bored.
Okay.
So I want to still make a contribution. I just like not to do it like 70 or 80 hours a week.
Yeah, right.
So some things we know. Trish and I are taking a 2-month cross-country road trip, focusing on national parks, kind of do a mental break from work and do that. Certainly involved in community still. As I mentioned, I'd really love to still help with economic development issues within Rutland to see if I can lend a hand to that, bring some energy to it and ideas, because I think we still got a long way to go there. I will remain on a few boards. I will remain on the Blue Cross Blue Shield of Vermont board. I'll remain on the VNA board. There are a couple other board things that are being talked about right now. So I'll stay involved. One thing I won't do is go to work for Trish in the bookstore.
God.
Of course, she owns the bookstore, is co-owner of the bookstore downtown.
Right.
And
Phoenix Books.
Phoenix Books, yeah. And she's made it perfectly clear that I can come help put up Christmas decorations in November and take them down again at the end of December. And I can certainly be welcome to come buy things there, but that's my role.
That's okay.
And it's perfectly fine.
Yeah.
So, and there are a few other kind of hobby things, like I actually love to cook.
Oh.
I'd love to spend more time doing that, and I really enjoy it. If you work a lot during the week,
you don't have time for that.
You don't want to come home
No,
and
I
start
know.
cooking at 7:30 at night.
No.
That's no fun.
No.
But if you have more time, that's something I'd like to do more of.
Excellent.
And of course, seeing grandkids and kids more often than I've been able to do over the last few years as well will be a key piece.
Well, I don't doubt that you're going to have a full retirement.
I'm hoping.
No,
I'm hoping.
I don't doubt that at all. And the community is grateful for your time, your talent, your energy, compassion. And fortunately, I'll see you around till the end of March. And thank you so much for coming in and being interviewed. I really appreciate it, Tom.
It's my pleasure. And I've said before, this job has been the highlight of my professional life. It has given me satisfaction and joy. It really has been a pleasure most of the time. As I've often said, I like my job 85% of the time, and that's as good as you get.
That's right.
And it's you never doubt for a moment that the work you do has value, and that is such a fortunate thing to be able to say.
Yeah. Well, thank you so much again. And I guess we're going to close our interview, so please continue to watch us on Peg TV, Channel 15. Thank you.
This is Shane, my therapy dog. I really enjoy bringing him to Rutland Regional Medical Center because I can just see what it does for the patients. I think we make a lot of people happy and relaxed when we come. It takes them out of really where they are. People I don't even know will say hi to Shane because they've seen him at the hospital. It's like, look, there's Shane. Hi, Shane.